When you go to the doctor, you can usually be confident in technology to deliver a quick and certain diagnosis for some of the common diseases. There are plenty of tests available to help doctors like John Nevin determine exactly what it is that ails us. So John, how did I go?
You passed okay today with flying colours, yep.
The blood test, of course, is a good test. What if I had something like diabetes? How would you determine that?
If you suspected diabetes, the way to diagnose that is to do a what's called a glucose tolerance test to see how your body tolerates a glucose level.
What about if I had a disease like heart disease? How would you test for that?
With heart disease, you can check blood pressure and also check the blood cholesterol to see if you're at increased risk of getting heart disease. And if someone who is otherwise well has those abnormalities present, they're at greater risk of heart disease. And there are things we can do which will prevent or reduce the likelihood of having a heart attack or a stroke.
So medical technology has made the body less of a mystery. The mind, though, well, that's another story. Dr. Linda Agnew is a senior lecturer at UNE in biomedical science. Linda, how common is mental illness like depression and anxiety?
David, we think that around 1 in 4 people in the community will experience depression. Now, this can be a range of symptoms from really quite severe, a major depressive disorder, right through to a condition that is perhaps less severe, but nevertheless the impacts of those conditions on a person's lifestyle are still quite significant.
Do we have a definitive test for depression?
Currently, the way that we test for depression is by clinical interview, and it does depend a lot upon the skills of the clinician as to the diagnosis. And during the diagnostic phase, during that interview, many clinicians get their patients to fill in a survey, a questionnaire about how they're feeling, and they will use the answers from that questionnaire to help them form the diagnosis. There isn't a simple test to diagnose depression and anxiety.
So what then are you looking for as part of the New England Mental Health Study?
Well, what we're really hoping to address is to really determine what are some of the biobehavioural markers that determine whether a patient has depression or not. And so in doing so, we will be using a survey and we will also collect some biological samples, because we do know that there are some biological markers that predict whether a person may be at risk of developing depression or may be experiencing depression.
Well, Kerry Fitzpatrick is the project manager for the New England Mental Health Study. Kerry, what are you asking for people who take part in the study to actually do?
Okay, initially people will be sent out a letter. We've been given permission from the Electoral Commission to send out 50,000 letters to random people within the New England Directorate. People will receive a letter in the mail or find out through the media. At that stage, we will ask them if they'll give us 3 samples. So one of those will be a salivette, which is a saliva sample. We ask you not to eat or drink anything in the morning. After 30 minutes after you wake up, you put the piece of cotton wool in your mouth, you chew it, it soaks up the saliva, you put it back in, okay, without touching it so that we don't contaminate it. So that's the first sample. Secondly, we have a nice little tube of mouthwash, okay, well it's a little tub here. Put that into your mouth, swivel it around quite vigorously, that collects cells from the inside of your mouth. If people are willing to, we ask them to come in and also give us a blood sample. Now we have a qualified doctor who takes the bloods. With all those 3 samples together and a survey, and if people can't do this online, I can certainly send them a hard copy. So that takes about 20 minutes. Collectively, these samples will give us an indication of the cortisol spike, which is a depression or anxiety indicator. We also look at the cells within your body, your immune system and your brain function. So this is where we're looking at the variables inside the body.
Kerry, what sort of questions are you going to ask them in the survey?
Okay, so the survey itself is quite easy. There's a few personal questions in there. It will go into a bit more detail about some things that you've gone through in your life. If perhaps you have been diagnosed with mental illness, how easy it is to get service delivery, how you've been helped, and maybe some questions about other family members. So it's a lot of personal information, but it's very easy. It can be done online on a hard copy, and I don't think anyone will have a problem with that.
And what you're trying to find there is just find out where they are in their life, what sort of...
Absolutely, and obviously this needs to be done within 24 hours of the other samples, because how you're feeling on that day will be directly linked to the kind of information we get back from the samples. So it's very important that people do it all in the one day.
What happens to that information once people have filled it out?
Okay, so it comes back to me. That information is entered into a database. At that point in time, people are de-identified. They just become a number on a barcode. Their samples go into a freezer. They just become completely anonymous, so the whole thing is confidential.
It's finding that link. It's putting the connection together between a physical telltale and the actual symptoms and signs that people who have a mental health condition like depression or anxiety suffer from every day. That's what the purpose of the New England Mental Health Study is all about.